Welcome back. Wendell Potter answering your questions on Obamacare. Chris in Worcester, Mass. Chris, you're
How you
on
doing
there.
today, guys?
Great. What's your question?
Somebody had called in earlier asking about what type of proof you'll have to have in order to say that you have had health insurance. That way you don't get penalized.
Right.
And it seemed like you guys didn't quite have the answer. I live in Massachusetts, so we've had the healthcare, mandates here for a few years now. And what happens around tax time is you get what's called a form 1099-HC, and it comes directly from your health insurance company. And it's your proof of, if you have had a full year of coverage, or if you've had part year, it'll check off, which months that you've had and things of that nature. And it has a federal ID number that you need to put in and things like that. So that is the proof that I'm assuming will be the same for the federal.
Makes sense, Wendell?
Thanks for that. I suspect you're probably right, because Obamacare is very much modeled after Romney Care.
Yeah.
So it'll be very similar to what the folks in Massachusetts have. I'm sure that there will be some mechanism like that for your proof of coverage.
Dawn in Greenlee, Colorado. You're on the air with Wendell Potter.
Hi. Yeah, I just had a question for Wendell. I am a retired union member. I have pretty decent insurance through the post office where I retired, and I'm just curious. I thought I had heard something about having to pay some sort of a supplemental for my premium insurance that I have already.
I don't think you'll need to.
Maybe I'm wrong.
It could be that there's something that is unrelated to Obamacare that might change your benefits, but there's nothing in Obamacare that I'm aware of that would have a bearing on that. There's nothing in the law that would affect that I'm aware of.
Okay. George in Keyport, New Jersey, listening to WWRL. You're on the air with Wendell Potter.
Good afternoon, gentlemen. Quick question. My wife and I are both in our late 50s. Basically, we have enough money set aside to retire, and we'd like to give up working and allow someone else to take our jobs. What could you possibly recommend for someone in our situation? The only reason we're working now is for medical coverage.
Boy, do I know what you're talking about. One of the best things about Obamacare for people of a certain age, I'm right there with you, is being able to leave jobs that you don't want to, you still want to keep working at them, but you're kind of locked into those jobs because of benefits. Starting January the 1st, job block will go away. You will be able to go to the exchange and shop for coverage on your own and get subsidies if you're eligible for them. Many people as we get older, we have pre-existing conditions and can't get affordable coverage. So this is a real godsend for people who are in situations like yours that would love dearly to leave their jobs, dare not to because of losing benefits.
Great.
That will go away. Okay. So on October the 1st, you'll be able to go to your exchange, check out what's available to you, what the prices will be, and then you can, on January the 1st, say goodbye to that job if you want to.
Armin in Bradenton, Florida. Quick question for Wendell, Armin?
I got a couple questions, and I'll try to be real quick. First off, for independent contractors, will it be you're adjusted after your expenses? Because that's a huge thing on your income.
I think it will be. I think it'll be based on, my assumption is that's correct.
Income. Okay, and then the second one, Mr. Potter, and God bless you, you're a really fine man. I've seen you a lot of shows, and I think you ought to be a senator. But besides that, Aetna, on that 9%, as long as the insurance, you won't have to if it exceeds 9% of your income. Is that based on a reasonable ground level of a certain quality of insurance? Because Aetna converted my insurance. I didn't find out about it till I had a heart attack, and they were charging me $666 every quarter for a maximum payout of $5,000. So if the insurance companies have that loophole to where they can make that 9% to where you can buy, they force you to buy crappy insurance. It's like 7 or 8% of your income that hits 80% of the middle class, but it's junk insurance like that pays out nothing but cost a fortune. Yeah. Then that's a loophole we want to make sure doesn't get stuck into Obamacare, because that's
got it.
What
Wendell?
we want to avoid.
You're absolutely right. We are going to have to be very vigilant to make sure that there are not loopholes like that. I think the thing that will hopefully protect us is that you have to have at least an essential benefits plan, and I think we'll keep that from happening.
Okay.
So
Sue and
crappy insurance will be banned.
Sue in Morgan, Pennsylvania. Time is getting tight here. Sue, quick question.
Okay, yes. I'm 65. I'm a widow. My husband was a veteran of the Second World War. Should I apply for Medicaid or should I apply for veterans benefits? I live in sub-poverty. I don't even make it to poverty level.
Well, I would do both. I mean, if you are eligible for VA benefits, by all means, check that out and go for it. I mean, the VA program has a very, very good program. Medicaid is good too. So if either option is available to you, check them out. And you may or may not be eligible for both, but I would check that out.
Okay. And let's see, Dave, if I can just read your question, you only make $1,100 a month on SSI. You're not eligible for Medicare. How can you afford an insurance policy? Dave in Kansas City, is that your question?
Yeah.
Okay, great. We just have like 30 seconds here. I wanted to get it out there real quick. Wendell?
Well, once again, if your income is really low and you need to get coverage, you're not eligible for a public plan already, you can get subsidies from the federal government to help you pay for both your premiums and your out-of-pocket expenses.
Which is a fancy way of saying the government will pay for your insurance, probably directly to the insurance carrier, and your out-of-pocket expenses as well. Wow, that's extraordinary. Dave, thank you for the call.
When do they do it?
Pardon?
When will they?
Oh, this all starts January 1st, Dave. You can sign up October 1st. Dave, thank you for the call. Wendell, thank you for being with us.
My pleasure, Tom. Thank you very much.
WendellPotter.com is his website. His book is Deadly Spin. It's a brilliant read. Check it out. And thank you for being with us.